Welcome a new episode of Promoitalia Channel. We are still in Montenegro, exactly in Budva, and now we arrive in Sweden because I have here with me the pleasure to have Dottoressa Alma Bello.
Yes, Steve.
How are you?
I'm very fine here in Montenegro.
You like it?
Yeah, I love it. I love it.
And Alma Bello is an aesthetic doctor, but not only doctor, because even is a trainer of Novoderma, Aesthetic Academy that have events academy at the center. For this reason, Alma Bello is a trainer. It's very important because 2 point of view. It means one like doctor and even like trainer.
Yes.
Well, I will go immediately to some question. Why you thinking that why the polynucleotide now is a prominent position in the world aesthetic medicine?
Because it's a very good product and the effect is very quickly if you compare with other biostimulator. So PDRN is very popular now in Sweden and even in Copenhagen, not only in Sweden. And we even spread that together with Melinda in Novoderma in other clinics, and I train other clinics too.
And you use polynucleotide?
Yes, of course. It's a good, very good product.
Which one?
All of them. I mean the strong, the medium, and even the soft for the eyes. And I'm using even the medium under the eye for periorbital treatment.
But you choose more soft for periorbital area or more medium? What the difference?
In the beginning, it depends upon the skin structure. I mean, when you have sagging skin and thinner skin, I suggest to do the soft. And it's 2 millimeter in it. And then you can even put that in here and even in the eyebrows to make it toner or lift. So that's why you have more product to use it. So I love soft. But when they are after the 4th session, then I go over to the medium because I wanted to have this better quality with the skin. And I mean, there is an indirect for the volume treatment.
And what I need to expect your customer about the procedure?
Mostly they are coming to me because of this swelling eyes, and there is dark under the eyes, and the skin is, the periorbital region is very, very difficult to treat. So that's why if they are coming to me to ask the filler, the dermal filler, and I said, no, you are not the candidate for it. I suggest the polynucleotide because of my experience and because of how it works inside the tissue.
It's painful?
It's a little bit painful, but I give a little bit kind of lidocaine.
And sometimes you see some reaction. What you can do with that to the pattern come to you? That little bit painful, but you can manage with some topic
topical, yes.
And about after procedure you have some redness. What do you need to wait?
Yeah, it's a little bit swelling the first, second day, and I inform that to them. And it can be a hematoma. It can be a little bit of what you call this one, redness. But redness is not so. It's like 1 hour, and then it's gone.
The redness in the end in 2 hours already is disappeared.
It's gone already. But the swelling is a little bit it's very individual because some of my patients, especially when you're older, then they have like 5 to 6 weeks, at least 6 days, and then some of them is when you are younger, then 2 to 3 days. The swelling is gone.
And do you treat both bags and dark circle or just bags? For
both of them. Yeah, it's a long-term kind of treatment.
And in the first session about the eyes, you see already some things or need waiting time?
Like the first treatment, yes, I can see that. The second session, you can see that better, but you can see that after 6 days. Then the patient see already the result. Because they are telling me that when they are coming to the second session, I already see the result. So that's very nice to. So that's why I love nucleophile.
Because it became all addicted.
Yeah. And the compliance is very high. When I told them that you need to do the 4th session because you are older than 35, then they are following that. No problem.
Okay. How many techniques you use for the nucleophile soft?
When it comes to periorbital region, I use both the needles. It's 30G and 4 millimeter. And then I'm using the 27G. I haven't used the 30G and 25 millimeter because some of the patients are so thin in their skin under the eye. And I want to reach with these wrinkles inside near to this area. And then I'm using even the 25G and 38 millimeter cannula.
A cannula, yes.
Yeah.
And with soft, you use only for the eyes or in some other part?
The soft, sometimes I'm using that soft because it's 2.5 polynucleotide. I'm using that sometimes in the neck area. And a little bit when you are sagging in this area near to the temporal region, so it will get a little bit lifting. I don't promise any volume effect, but I promise the lifting capacity because the skin is doing it. The reaction is the skin toning in this area. Because we are always sagging in this area, so I used to do this fake eyebrow because to lift this area with this nucleophile.
I give another question that is not out of the protocol. What do you thinking if we can use polynucleotide in the stretch marks? You are experienced, expert. What do you think about it?
I think it will be. I think it will be a good result. Both the red marks and the white one.
Yeah, because anyway. You go to stimulation, collagen.
Yes.
This will be maybe the new vision about polynucleotide.
I will tell you, I'm using it already.
Okay. This
yes.
is very. I don't know. This is very important.
I have a patient. I think she's my assistant, and I used it because she did this blepharoplasty in the upper part, and her marks is red. And it's disturbing her. Yeah. And I'm using this, the eyes and even the medium. I'm using it, and then now you cannot see it if you need to see like that, no, it's not red anymore. I don't know if there is a magic or the polynucleotide, but the color is normal again.
Yeah, for this reason, even for the stretch marks, that that we have redness and white about stretch mark, you can improve. You already have a work about, but just ask to you because I won't ask for you point of view if for you will be is other protocol about this new kind of problem in our market.
Yeah, I saw the result, so that's why I'm impressed with this product.
Thank you for your witness. Thank you for coming here in our channel. Thank you for staying us in Montenegro. Enjoy, our summit and even, our gala dinner. And I hope that you continue to train a lot doctor in Sweden and even in Denmark. And you make the brand nucleophile more famous that already is very well product around the world.
Yes.
Thank you again.
Thank you for having me here on Novoderma Melinda. Yeah.
Thank you.
Thank you very much.
And see you in next episode in Promoitalia Channel.
Thank you.